When a person is diagnosed with Alzheimer's disease or other form of dementia, the long-term care becomes priority number one. Patients and their families want a facility that can help manage the symptoms while also living in a place that feels like home. The Cottage at Wexner Heritage Village can offer all this and much more. And joining me from the Cottage, Medical Director Dr. Sanford Melmed and Colleen Krupp, also from the Cottage. Welcome to both of you.
Thank you.
Colleen, do me a favor and first explain the idea behind the Cottage and why you say it is a great place for folks, because it is a home-like atmosphere.
The Cottage is assisted living for the memory support for mid to moderate stage dementia. And at Wexner, we realized there was a niche that we needed to fill. It kind of fills the space between assisted living and long-term care.
Mm-hmm.
So it's a home-like setting. It's designed to have people engaged in their environment, their day-to-day living. So they'll be part of the activities, part of whether they want to set the table or whether they want to sleep in a little bit that day. So we allow them to set their own schedule, just like you would at home.
Which is very helpful for the Alzheimer patient, isn't it? Doctor, what are some signs that families should look for, and especially as we're heading into the holidays? You may not have seen mom or dad for an extended period of time. All of a sudden you're sitting down with dinner and questions start to come, like, is this normal? What are some signs?
The most overall sign, I would say, would be a change in memory, of course, judgment, behavior, completing tasks. There are a whole host of things, but those are probably the earliest signs that you see.
And when someone does think that there's a possibility of Alzheimer, what should be the first step for a family to take?
I would definitely advise someone to go see their doctor as soon as possible, because there are good medicines out now. Unfortunately, the medicines don't cure, but they improve the quality of life and keep the symptoms from deteriorating as rapidly as they might otherwise do.
So it is important now, and we have come a long way in treating this, so it is very helpful the earlier that the signs are recognized, the better.
Correct.
So if someone then goes to a place like the Cottage, how helpful is that, and not necessarily the recovery, but their day-to-day living for these folks, Doctor?
It's an excellent environment, I would say, as opposed to the long-term care environment, which is the typical Alzheimer's unit.
And what is the difference?
The difference would be that the long-term care units have a little bit more of an institutional feel to them. Many times the residents are grouped in the center with not much interaction, as opposed to the Cottage, where there's memory support and the staff is trained in that, and that's their thing.
We were just looking at video, and it looks like a beautiful place, Colleen, and that's really what you wanted. You said that the amenities and all these things are important for the patient.
Correct. And going off what Dr. Melmed said, it's definitely all of our staff has been trained to be certified dementia practitioners. So it's the way we approach people. So if someone doesn't feel like doing something at that moment, we'll come back 5 minutes later and say, how about having a cup of coffee at the table? Even just being passive in the sense of being part of the group, even if they're just sitting having a cup of coffee, is important. The social interaction with their day-to-day and keeping them.
Does that help then in the long term and as they progress in the disease, if you keep these folks socially active?
Absolutely. It keeps their skills and their social interactions to where they were before, as well as just the day-to-day and the interaction and being able to have meaningful conversations.
Doctor, I've heard it expressed before that someone says you need to live with where the Alzheimer patient is. How would you explain that to people?
Well, I would say that sort of feeds into the type of thing we do, which is guided independence, that we allow the patient to be, or I should say the resident to be independent to a point, of course, and then the guided part, of course, is taking them along and assisting them and seeing what we can do for them as an individual, again, as opposed to a group setting such as most units.
And so then the Cottage then is a continuum, so they could go from there to other places at Wexner.
Yes, there is a long-term unit for an Alzheimer's unit, basically, when they get to the point where they just cannot be handled in any other kind of environment.
And I'm sure for families that continuum of care is very important, and for the resident as well, knowing where everything is and what everyone's going to do going forward. Well, we've had your phone number and website up there, so if any folks do have questions, they can give you a call or contact you. Thank you both.
Absolutely. Thank you.
Thanks so much.